So from this lecture, you kind of wash your brain about gram-positive out. So now this is gram-negative cocci, okay? And since gram-negative cocci is very small group of bacteria, you probably spend like half an hour for finish all of them. Then I put some actually gram-negative coccobacilli group in the bacilli form, but well, since I see it's small together, so then we will learn gram-negative cocci and gram-negative bacilli. This is the hardest group of medical bacteriology, bacilli, gram-negative, because they have a lot. You probably need to think about so many bacteria that you're quite familiar. For example, Salmonella, Shigella, Escherichia, Pseudomonas, Vibrio, Proteus, Klebsiella, a lot more. Ralstonia, Burkholderia. Then, so that's quite a lot. So in this lecture, we will start with cocci first. Cocci is small group. Gram-negative cocci, that's important for human pathogen has one genus called Neisseria, okay? Neisseria, that's important to human pathogen, has two species, only two species. One is Neisseria meningitis, cause meningitis. Another one is Neisseria gonorrhea, cause gonorrhea. Okay, gonorrhea refer to โรคหนองใน no? So this is the real gonorrhea. We have pseudo gonorrhea also. Okay. Neisseria will show up is diplococci. So normally, if you think about diplococci, you probably think about Streptococcus pneumoniae. How can I say? If the cell is oval, they have kind of oval, not round. Pneumoniae be diplococci like pole and pole, lancet shape attached. But diplococci in gram-negative, they kind of attached in the long side. Some people say the shape like kidney bean or coffee bean. Okay, it looks like coffee bean. This is the characteristic. They non-motile, process pili. Okay, non-spore forming, non-acid fast. You know that it is aerobic bacteria, but need carbon dioxide to enrichment in the growth. Oxidase positive, catalase positive, okay. The cells process very regular gram-negative peptidoglycan, okay. Let's see the oxidase test. We never talked about the oxidase test before. Previously, you learned catalase test, right? Bubble happened by the drop of hydrogen peroxide, and also coagulase test. The oxidase test, we use we want to test that for identify the cytochrome C oxidase in bacteria or not. So bacteria kind of aerobic, they have electron transport chain, okay? But we prepare a mimic chemical to the system that is TMPD. This one, this tetramethyl paraphenylene diamine, okay? This one can be electron donor, send it to cytochrome C oxidase, okay? Once it oxidizes, it can send the electron to cytochrome C oxidase. It will change the color to the purple blue color. the lab start from a Wattman filter paper. You drop the reagent TMPD, and then use plastic glue, pick the colony and transfer colony to the paper that soaked with the reagent. The positive will call when the purple color form within, it depends on paper, 10 to 30 seconds. Some say within 1 minute, that's okay. If they never develop the purple color, that means oxidase negative because that reagent never transfer electron to cytochrome C oxidase. They probably have no cytochrome C oxidase. Okay. The first bacteria that we try to mention is Neisseria meningitidis. They cause meningitis. Okay. This bacteria, the important thing is they have capsule switching. They process capsule around diprotoxide. Once the capsule has be also antigen. Once the capsule happen, they induce immune response. Immune response to capsule try to produce antibody to be an opsonin, right? To make opsonization of capsule, let macrophage eat bacteria easily. But once they trick by antibody, Neisseria gonorrhea, Neisseria meningitidis can switch the new set of capsule protein and come up. So they change the new antigen all the time. That means they escape immune quite quick. Okay, this is the machinery of meningitis. The virulence factor of this bacteria, obviously capsule, pili. This is special. Normally, bacteria produce capsule. They project pili out of the capsule. So capsule pili attached together. Pili help Neisseria attach to the host epithelium cells. Okay, capsule anti-phagocytosis, and they process opacity protein OPA and OPC for adhere to the host cells. Also, they release, they infect the throat, something like this. IgA has a key antibody in the mucosal immune response. So they produce IgA protease to degrade IgA. Once IgA degrades in the mucosal area, so opsonization cannot happen. And also has endotoxin, so coming. Endotoxin, we refer to LPS, lipopolysaccharide. But endotoxin of Neisseria is very short in carbohydrate. So we name it lipo-oligosaccharide, not poly, LOS. They have very short O antigen, okay? This toxin can make the host cell necrosis, okay? This is the LOS. They have lipid A. Lipid A immense to the membrane, outer membrane. They have inner core, outer core. But O antigen, you see O antigen is branching, but they come from the same component. The same component. So the variation is so few variation. All right. Pathogenesis happen by bacteria attached to epithelium. Okay, once they are attached to epithelium, they release toxin. Okay, they release toxin. They promote the epithelium cells, phagocytose them inside. So once they go inside the epithelium, they release toxin. Toxin let the vesicle break down, and they pass through the pair patch underneath the epithelium, and go to the blood circulation. That's the mechanism. So toxin destroy PMN and block the T lymphocytes. So then immune response cannot, it's fail to get rid of Neisseria, meningitis, okay? So people who get infected might have this, the main symptom as stiffness. Stiffness, it means you cannot move the head, the neck easily. And once you move the head and neck, it's super pain. So diagnosis of Neisseria, doctors supposed to do the lumbar puncture. Lumbar puncture means they draw the CSF, cerebrospinal fluid, from the lumbar, okay, because the nerve is thinner than the other area. So the CSF that drawn, they contaminate with bacteria and also white blood cells. When you culture that, you can see Neisseria meningitis. This is the main specimen because they cause meningitis. Okay. This bacteria, well, very serious to baby less than 2 years. But that's not mean like adult cannot happen, but mostly attack baby. Baby, the less meningococcal cause like about 18 months children, quite a lot. But the immunity in the baby is stronger every year. So the incidence of the meningococcus is dropped. That's the epidemiology. Treatment, still penicillin is good in some country. So, well, some countries overuse penicillin, and Neisseria coming from resistance, cephalosporin became the first line treatment also. We are so lucky we found that penicillin resistance is very rare in Neisseria meningitis. Okay. Prevention, we have vaccine. So one vaccine for children, another one for adults. Okay. The purified polysaccharide vaccines for children and conjugate vaccine for adults. Neisseria gonorrhea. Okay, this is also coffee bean. You probably, the Neisseria gonorrhea cause gonorrhea. Okay, they cannot grow in blood agar. So to culture Neisseria gonorrhea, you need modified Thayer-Martin chocolate agar. It is fastidious. Fastidious means not easily grow. They need supplement a lot. Okay. The process, LOS, endotoxin, outer membrane protein. Okay. Both of them are on the outer membrane protein. And OPA protein, same with meningitis. Actually, meningitis and gonorrhea are quite closely related bacteria. Okay, let's talk about chocolate agar plate. Well, blood agar and chocolate agar differ in the method to prepare and the purpose of use. Okay, blood agar, we use that for detect hemolysis. Okay, it is nutrient-rich medium. Chocolate agar also, but heat at 80 degrees Celsius, it's good for fastidious bacteria such as Neisseria, Haemophilus, something like that. The color is kind of chocolate. Actually, it's heat blood. Okay. The Thayer-Martin chocolate agar use cheap red blood cells plus vancomycin, polymyxin, and nystatin. The vancomycin kill gram-positive bacteria, right? They attack in the cell wall. Polymyxin kill gram-negative bacteria, except Neisseria. So with this, and also nystatin kill fungi. So thiomartin is referred to red blood, chocolate agar plus antibiotics. So when you get specimen that contaminate with so many normal flora and you grow on enrichment media, everything can grow quite quick. So this medium can stop down the other bacteria and let just only Neisseria can grow. But for Neisseria gonorrhea, we not use thiomartin alone, we use modified thiomartin. That means everything plus thimetocrim to inhibit protease also. Protease grow quite quick. When the protease grow, they occupy the surface of the surface agar. That make the colonies hard observed. Okay, if you see this picture, the colony of Neisseria gonorrhea is so small. You probably see this white dot, something like that. That's hard. If protease grow up, you kind of impossible to see. Okay, so Neisseria gonorrhea and meningitis is quite similar. The way that differentiate two of these each other depend on the maltose fermentation. So maltose fermentation is, well, the sugar fermentation has a series of sugar. You have maltose, glucose, arabinose. There are so many, but just only maltose differentiate that. Neisseria meningitis can ferment maltose in the medium. The control medium is colored red by phenol red. Phenol red turn red when the media in neutral or tend to alkali. But when meningitis change the sugar to acid and sometimes gas, the acid inside the media turn phenolate to yellow. So then this is positive. But for gonorrhea cannot ferment maltose. So then gonorrhea get negative maltose fermentation. Okay. In gonorrhea, antigenic variation, same. Okay. Same with meningitis. That means when you have Neisseria population, mostly surface covered with what color? The purple color. And one of them are red color. So antibody will react with most of the population. So the purple color get rid off. Just the red color, the new antigen can boom up. So that means population of Neisseria change antigen. And also when they get the new antigen, something also can mix inside the population, the newer antigen. Once antibody against the red one die out, the green one coming. So this is the way of antigenic variation. Neisseria keep changing antigen. That make them survive in the immune response. Neisseria is serious now. Well, people concerned about Neisseria 40 years ago. Together, Neisseria is one of the very serious sexually transmitted disease in the US, actually everywhere, including in Thailand 40 years ago. But once at that time, people get serious in syphilis and gonorrhea. Syphilis, gonorrhea is kind of key disease for young adult until very old age. Okay, so once HIV coming, people scared to die, and we know that the condom can prevent HIV, and lucky us as condom can prevent gonorrhea also, and the incidence of gonorrhea dropped by number of HIV coming. No one want to go unsafe with the sex partner, so then they use condom. So the situation's kind of much better. Well, still, gonorrhea is a problem in the United States and also in Thailand. The reason I mentioned this because the new wave of gonorrhea come with drug resistance. The way that we use antibiotic to treat gonorrhea now is kind of not work in some cases of patients. Interesting in epidemiology, this statistic come from the year 2 years ago. Okay. Actually last year. We looking for American population, male get infected larger than female, okay, for gonorrhea. And the ethnic inside the American population, mostly black male. Okay, that's quite serious. For Asian, it's quite few, but still 9. When we think about the distribution by year, okay, gonorrhea is very dangerous long time ago, and the number dropped again until 2015. Gonorrhea come back with this wave with antibiotic resistance. That's why we need to concern about it. For age group gonorrhea, mostly 20 to 24, they get infected by the university student quite a lot in the US. The problem of epidemiology is people can get infected with, if you not say something like I get infected with gonorrhea, no one can know that. But if you not get severe gonorrhea, you get mild gonorrhea, no one know that. And once you know that, patient probably shy in your age and not go to see doctor. That's why number of gonorrhea is kind of high. Okay. There are some gonorrhea happen by the infant also. Infant is not have sex with the other, but infant get infected from mother who got gonorrhea. Okay, that's the statistic. Well, what about in Thailand? I found a paper that talk about the urethritis. Okay, the information of urinary bladder in 4 or 5 years ago. They survey from patient of 1,026. So they are all male, okay, but male who have sex with male and who have sex with female. So number is quite a lot, right? Heterosexual get gonorrhea together a lot. The age is around 18 to 29. That's same pattern with the US, okay? And never use antibiotic for 2 weeks, quite a lot. They don't go to see doctor. Virulence factor of Neisseria gonorrhea has so many things. They have membrane protein, okay? Pili, lipo-oligosaccharide, this is endotoxin, okay? Porine protein, OPA protein, okay? Membrane protein, this for attachment, attached to the host cells, okay? Some ion channel pull iron out together with antibiotic, okay? This is the drug effect pump. and also pump out of the toxin material. Okay, they can switch the new antigen. Okay, and also some enzyme to degrade the oxygen species of toxic substance that cells might harm bacteria. Neisseria is intracellular bacteria. Okay, get infected by attached to the, well, Neisseria probably be normal flora for vagina, for throat also. We found Neisseria on throat and infect vagina by heterosexual and homosexual. Neisseria use pili and machinery to attach the epithelium cells. And once they colonize over than the other flora, they go inside that they call transcytosis. Let the cells phagocytose them and move past the cells to the lower patch. Okay, Neisseria can block macrophage by going inside the macrophage and block dendritic cells and PMN. Can make PMN necrosis, and then they go to the target sites. The manifestation, it can be quite broad of disease. One main is genital gonorrhea. Genital gonorrhea get urethritis. In male and female is quite different. Disease in male happen after you get infected for 2 to 7 days. Okay, incubation period. You probably know that. But female has mostly asymptomatic. Well, when female get infected, you probably don't know you get infected, or the symptom is less than in male. In male is shedding pus from the penis. Well, you probably know that, and it pain from the pus shedding. Okay, the specimen for the lab, doctor will use swab, take the pus sample, the pus smear to slice and use gram stain. The important thing is, well, you have no lab to see. If you detect Neisseria gonorrhea, you see diprococci in coffee bean chaff inside red blood cell, because red blood cell eat it. Neisseria gonorrhea is intracellular bacteria. They grow inside bacteria, not grow outside the cells. This is not the Neisseria gonorrhea. Okay. Some patient can get infected in the rectal. Well, you probably shed pus from the rectum also. Can happen by female or male who's kind of homosexual male. That's the kind of risk, okay? By rectal intercourse, something like that. But female, well, the anatomy of female sexual organ, vagina and rectum is quite close to each other. So in case of some people who get cross infection from vagina to rectum, you probably get rectal gonorrhea also. In some patient who get pharyngeal gonorrhea, so there might be genital oral sex, okay? Then gonorrhea occupies in the throat, but some people may be asymptomatic, no symptom, but if they have symptom, you get throat, sore throat. Our doctor observed some pus here, and this is normal. When I ask students take working in pair and take swab to touch some area in toxin and then swab on slide and perform gram stain. You probably see gram-negative cocci in pair as a normal flora. Don't worry, like you get infected something. It is a normal flora for general. Can be conjunctivitis gonorrhea if they infect eyes. Also, if you not treat it in the right time, you probably go to the sequelae is blindness. Okay, something like that. Okay, disease in men and women are quite different. In women, mostly asymptomatic. You see the white areas quite a lot. In men, mostly acute urethritis. Okay, so bacteria colonize in the urethritis duct. Okay, but spreading of bacteria to the blood circulation is quite rare, but can happen. And finally get infected in, well, bacteremia or sepsis in the body. That is rare case, but can happen, okay? That's also dangerous. In female, local infection, local complication will happen larger than in male, okay? That is different. So symptoms are quite different between sex. All right, then we move on. Diagnosis. Diagnosis can do gram staining, culture to find Neisseria, or now we use nucleic acid amplification. That's PCR. Detect the Neisseria gonorrhea. Treatment. GC is mean gonococcus, gonococcal, and chlamydia. Chlamydia you learn next week. They have the same way to treat together. Okay, streptizone can work well with this. Well, to prevent it, condom can block transmission. Okay, one thing you probably know before, chlamydia. Chlamydia is causative agent of pseudogonorrhea, หนองในเทียมนะ. The symptom is quite similar to GC, but it's caused by different bacteria. Okay, something else. Okay, we move to another group of bacteria. Okay, genus Haemophilus. This bacteria has a change. This group of bacteria are very small bacteria. Itself, by the size of bacteria, is super small. Gram-negative coccobacilli. Okay, classification in phylum Proteobacteria, in the group of gamma Proteobacteria. Order Pasteurellales, family Pasteurellacea, genus Haemophilus. Important species refer to Haemophilus influenza, Haemophilus ducreyi. Okay, and another Haemophilus. Now they move out from the genus Haemophilus to the other group I'll mention later. General characteristic, you see bacteria is very small. The red dot is not bacteria, but this tiny dot is bacteria. You see, super small. When I zoom the picture, it kind of coccus or bacillus, hard to say, coccobacilli. Okay. In long time ago, in 1892, we thought that this bacteria is causative agent of influenza or flu. Okay, that's why every time people get flu infection, we isolate this bacteria from the throat. So we thought that this bacteria cause influenza. That's why we name it Haemophilus influenza. But we now know it is secondary infection when influenza virus infected. This probably be secondary infection to make patient weaker and finally develop pneumonia. Pneumonia not come from strep pneumo alone. The major cause, another major cause is Haemophilus influenza. Okay. To grow bacteria, they need factor 10 and factor 5. Okay. Some people say X factor and V factor. This is the plate used. People spray them with Haemophilus influenza, apply factor 5, factor 10, and this plate apply both factor 10 and factor 5. You see bacteria grow just around the plate of factor 10 and factor 5 because they need that, okay? They cannot move non-motile bacteria transmitted by small drop of the respire. When people coughing, talking, you generate some small drop, then you might get infected by get another drop of who get infected into your body. It is normal flora to human respiratory tracts and oral cavity, okay? So there are two main species that have clinical importance. Influenza cause pneumonia and nuclei cause chancroid, okay? And the other Haemophilus are parainfluenza, whatever. They are normal flora. They're kind of good guys in your body, okay? This is influenza, grow on chocolate agar, okay? Normally, X and V factor, factor 10, factor 5, refer to heme and nicotinamide adenine dinucleotide, okay? Heme is important for cytochrome, whatever cytochrome, use heme. NAD is coenzyme that found in blood. So both of them stay in the red blood cells. Since Haemophilus has no ability to lyse red blood cells, okay? You need to prepare chocolate agar. Chocolate agar, red blood cell lysis and release factor 10, factor 5 out, then that's happened. It's very easy for Haemophilus influenza. So influenza has 6 serotypes, A, B, C, D, E, F, 6 serotypes, but the virulent one is type B, or we call HIB. HIB refer to Haemophilus influenza serotype B. The colony is super small, pinpoint colony. This is not Haemophilus influenza colony, but the colony is here. You see, this one is pinpoint colony, so small, okay? Catalase positive, oxidase positive, okay? If you want to grow Haemophilus, probably need to co-culture with Staph aureus. Normally, we streak influenza zigzag like this on the blood agar plate, and we streak Staph aureus across the streak of influenza, H influenza. When Staph aureus grow, you see beta hemolysis. They hemolyze blood around aureus. When the area around Staph aureus rich of factor 10, factor 5, then Haemophilus can grow. The colony of Haemophilus that stay near Staph aureus is bigger than the Haemophilus that stay further than Staph aureus. So we call this as satellite phenomenon, okay? when we talk about satellite phenomenon, you probably think about Haemophilus influenza. I will jump to the treatment. Vaccine. We have HIP vaccine prepared from type B capsular polysaccharide conjugate with diphtheroid toxin, because diphtheroid toxin is very potent. Okay. Another one is Haemophilus ducreyi cause chancroid. Chancroid ก็คือแผลริมอ่อนนะ is a type of sexually transmitted disease will happen mostly in Africa, Southeast Asia, India, and Latin America. When we talk about chancroid, indeed you need to think about chancroid because they get lesion, and the age of lesion is soft. That's the chancroid. But the age of lesion is hard. That's syphilis. Okay, the lesion of chancroid is painful, but lesion of syphilis is no pain. That's different. You probably learn together when we mentioned about this again. When you learn syphilis, the incubation period is very short. Once get infected, maybe you show up the symptom in day 2 to day 5. Okay. Chancroid nowadays is not a big problem, but except the one that come together with HIV infection. Okay. And people can get auto-infection. I mean, this area of skin get infected with chancroid, right? Haemophilus ducreyi, and bacteria in this area might move to some area and get another lesion here. That's auto-infection. Not get infected from someone else, but from yourself. That's the one. Okay, that's about chancroid. We have not so many cases. Another bacteria, Bordetella pertussis. Okay, previously named Haemophilus pertussis, but now we move out from Haemophilus. They also coccobacilli. Okay, cells very small. They produce capsule, aerobic. They need NAD to grow. Okay, they need NAD. Well, the culture of this bacteria need well, to identify species of this bacteria, we use charcoal blood agar. You add charcoal in the blood agar, then turn blood agar black. This bacteria will produce the metal fraction of the colony. We call the mercury drop. Colony is very small, just like you make a drop of mercury. There's shiny in the heavy iron. Nothing much. So let's go to pathogenesis of disease. Pathogenesis of this disease start from attachment. This bacteria infect the throat. Bordetella pertussis cause the disease name pertussis. In Thai we call โรคไอกรนนะ This disease has main symptom is coughing. Well, when this is serious for young children. The pattern of coughing is very specific. I think there are not so many diseases that have specific pattern of coughing. One is parainfluenza virus infection that you learn later. Coughing sounds like horse coughing. Another one is Bordetella pertussis, we call whooping cough. The last one is dry coughing, is tuberculosis. Bacteria attached to the epithelium cells. Normally, everything that attack to the throat, epithelium will propel and get rid of bacteria, and you coughing out, you sneezing out, and get the bacteria out of your body. Okay, but these bacteria, the red one, attached to the epithelium. Okay, they use FHA. FHA is referred to filamentous heme agglutinin. That's bind to the epithelium and use agglutinin, whatever, attached to the cells, and they release tracheal cytotoxin to paralyze the cilia, the cilia of the epithelium cells, so then they cannot get rid of bacteria. Then this bacteria produce pertussis toxin or PT toxin. PT toxin is AB toxin. They pass the toxin through the epithelium cells. Toxin can increase the population of T lymphocyte and pull T lymphocyte in this area and block T lymphocyte action. One innate response of this bacteria is cells, your body tries to produce mucus. Okay, the mucus that even make your body weaker. You breathe harder, particularly children, and also macrophage came to get rid of the bacteria, also a toxin. Bacteria produce another thing called adenylate cyclase that kill macrophage by apoptosis. That make bacteria win over the immune response. So finally, disease happened. So treatment, penicillin is useful. Vaccine is DTP. This is the last one in the combination. Diphtheria, tetanus, and pertussis. Okay, I think that's for gram-negative cocci and coccobacilli. Okay. So, do you have anything to ask?